Hey guys, it's Phil coming at you with another video. Today I'm going to go over questions that have different varying clinical considerations. I'm going to identify what type of question it is, as well as how to view it and if we can apply the acronym or not. So I just want to say thank you for all the support, and thank you to everyone that has been joining my study groups as well as engaging in the private tutoring. People are seeing positive results, and I just want to say congratulations to anyone that I have been tutoring and or that have engaged in my study groups or even just watched my videos and have passed the exam. You guys are amazing, and the amount of support that you guys have shown blows my mind every single time, and it keeps me wanting to create videos for you guys. So let's get into this thing, guys. Okay, and again, I do offer private tutoring, so if you're interested in that, feel free to send me an email, reach out to me. Even if you have questions regarding the exam, I'm open to anything that you guys have. Okay, so the first question. A social worker at a family agency is completing an intake assessment with a 40-year-old woman who experienced a breakup this past month. The woman reported feeling down, not feeling like eating, having low self-esteem, and finds it difficult to think about anything other than her ex-boyfriend. What is the most likely diagnosis for this client? So first off, we want to say that this would be recall/application, no acronym here. And the sole reason is because it's asking for a specific answer, as well as you would need to have knowledge of the DSM to be able to answer this. So we're completing an intake assessment with a 40-year-old woman, and there was a recent breakup in the past month. And since it's a diagnosis question, we always want to emphasize on the length of time that the person's been experiencing this. So the symptomology we're dealing with is feeling down, not feeling like eating, having low self-esteem, and finding it difficulty to think or keep concentration. And so major depressive disorder, adjustment disorder with depressed mood, generalized anxiety disorder, or depressive disorder, NOS. So for major depressive disorder, the person has to have the symptoms for 30 days or more. Adjustment disorder is 3 months or less, as well as the reaction to the change is beyond the expected reaction. Generalized anxiety disorder is 6 months or more. And depressive disorder, NOS, does not meet criteria for major depressive disorder. So here we're looking at around the month. So B is going to be incorrect here, because when someone has a breakup, their reaction is going to be similar to this woman. So it's not disproportionate to what we would normally expect. So B would be ruled out. 6 months or more is not in this because it's only a month. And this lady does meet full criteria for major depressive disorder because she's feeling down, not feeling like eating, low self-esteem, difficulty concentrating, and it meets the criteria for the length of time. So major depressive disorder would be the correct answer here. So question number 2. A 5-year-old boy is referred to a school social worker by his teacher. The teacher reports that the child will often fall asleep in class, finds it difficult to share with peers, has frequent fights with peers, and has frequently missed multiple days of school in a row. What should the social worker do first? So keep in mind this is a first question, so we're going to be looking at an application question or reasoning. And so let's decipher the question, and we'll be able to select which option it is more clear. So we have a 5-year-old boy and referred by the teacher, and the teacher is reporting the information. So that's going to be very important when we're gearing towards the answer. So this child is falling asleep in class finds it difficult to share with peers, has frequent fights, and has missed multiple days in a row. So those type of symptomology is going to gear us more towards abuse and neglect, and that would have us do an application style question. So typically when we approach a clinical breakdown or a clinical analysis, we're going to be looking at an application style question, because we're going to need social work terms and concepts to get us closer to the answer. So we can use this handy little acronym that I use, and I'm planning to produce a video on what this acronym means in the future, so bear with me, guys. So contact Child Protective Services, so that would be a safety refer option, because we give in hybrid, because it's a primary dealing with the safety, but you would also be referring out to a different agency. Contact the child's family to inquire more information. We're going to be looking at an intervention, because the word contact is an action, and it would be having the social worker do an action. Speak with the child, so this would be a safety, because you would ultimately be dealing with the symptoms that he's experiencing, as well as we're going to get of feelings, because we're going to be getting the child's specific view of the situation. Work with the teacher to develop a behavior plan to address the identified concerns. So this would be an intervention or intervene option, so we'll rule that out. And then we'll also rule this out, because intervene is down at the bottom of the acronym, and those two are below the specific needs at hand. So here, a key thing, like I said before, the teacher reports it. So whenever there's an abuse and neglect case, and the teacher is referring, or the teacher is telling you the information, you're always going to want to go with the child. So the answer here, safety, is also at the top, and feelings is the second option, and refer is the third. So that is why that would be correct. However, depending on your state, it may vary, but generally with a rule of thumb and with what I've experienced, that would be how you would view that question. So question 3, a hospital social worker meets with a 58-year-old woman and her 60-year-old husband. The woman just had back surgery and states she wants to go home so that her husband can take care of her. The woman and husband state they do not have any supports in the area, but should be able to manage things on their own. What should the social worker do first to help the couple? So keep in mind that we're a hospital social worker, and what our roles and responsibilities would be. In this case, it would be more or less around discharge planning. So our clients here are a 58-year-old woman and a 60-year-old husband. So I'll highlight those. And she just had back surgery, and she wants to go home. And the woman and husband state they do not have any supports in the area, but they believe that they should be all right. What should the social worker do first? So we're going to be looking at application or reasoning here, and since it's a clinical breakdown, we're going to be looking at an application again. And then our target people that we're serving is both the woman and the husband, so the couple in general. So keep that in mind as we go through the responses. A, respect the woman's right to self-determination. B, explore the various resources in the area available to the couple. C, suggest the couple consider a rehab center until the wife is more independent at home. Or D, validate the woman's feelings around her current situation. So A would be an intervene, because you would be doing something to further provoke. Explore the various resources in the area. So this option, explore, is going to be an assess. Suggest the couple consider a rehab center until the wife is more independent at home. So we're going to be looking at an intervene. Validate the woman's feelings around her current situation. So here is where it's about to get a little tricky. So we'll rule these two out because they're both intervenes. And on face value, this would be assessed, but this would also end up being a safeties option to make it safety as well as assess. And the reasoning for this is that the woman just had back surgery and they have 0 supports. So we would want to ensure that the people are best equipped to thrive in their own environment. And the target people is here for the couple. And this bottom option is only recognizing the woman's feelings. And in this scenario, she hasn't said any type of feelings or struggles or anything. So we wouldn't really be able to recognize any feelings. So we would rule this out. So that would mean the safety assess is the correct answer here, because this is talking about both the man and the woman, so the couple, and then the target population is the couple. So you always want to keep in mind who you are serving in the specific questions while answering. So that is how you would answer that question. Oops, let me scroll that down. So, whoops. A 21-year-old Mayo College student presents at a community mental health clinic regarding concerns of excessive worry. He reports that he was recently sexually abused by one of his roommates at a party 3 weeks ago. Since the event, the client reports not being able to sleep and waking up in the middle of the night, only coming home at times when he knows his roommate will be gone, and feeling more anxious while around his friends. What is the most likely diagnosis for the client? So we have a 21-year-old male college student. We're at a community health clinic, and they're looking at an excessive amount of worry. He was sexually abused, so there potentially could be some trauma. And this happened 3 weeks ago, and this was done by one of his roommates. So since the event, that's significant, so it's likely going to be geared more towards a trauma. So he reports not being able to sleep, so that's one symptom. Waking up in the middle of the night, only coming home at times he knows his roommate will be gone, so some type of avoidant type behavior, and then feeling more anxious while around his friends. So this is a most question. So this one we're going to be looking at more of an application style of recall. So we would need to not have knowledge of the DSM, as well as it's asking for a specific type answer. So with this, we would need to know the specific amount of time. And the key thing driving us here is that 3 weeks ago. So with acute stress disorder, this is less than 30 days. Again, generalized anxiety is 6 months or more. Post-traumatic stress disorder is 30 days or more. And the mood disorder does not meet criteria for a mood disorder. So we're going to automatically rule out a mood disorder. And then since that would take 6 months, and it's not excessive worry on a whole lot of stuff, it puts us in between acute stress disorder and post-traumatic stress disorder. And since it's 3 weeks ago, we're going to be leaning more towards acute stress disorder. So these are very, very similar in the symptomology. Some may say that acute stress disorder is the precursor towards post-traumatic stress disorder. And the differentiating factor, just think of something that's acute. It tends to be very short. And post-traumatic means it's more longer term. It's very traumatic for the person, so it takes a little bit longer for them to get back on. So That is why acute stress disorder, because it happened 3 weeks ago, and post-traumatic stress disorder would be 30 days or more. So that is how you would answer that question. So the next question, a social worker meets with a 25-year-old client. Whoops. Who reports having difficulty controlling her anger. The client reports that she recently lost her job due to a heated argument with her boss. The client reported that her mother died a year ago, and she has not felt right since. At times, the client will engage in substance use and self-harm to help cope with the stressors present in her life, and states, I just don't know what to do anymore. What should the social worker do? Social worker address first when working with this client. So we're working with a 25-year-old client. Reports having difficulty controlling her anger, and she recently lost her job, and that's because she had a heated argument with her boss. That her mother died a year ago, and she has not felt right since. And then at times she'll engage in substance use and self-harm to cope with the stressors, and states, I just don't know what to do anymore. And the first question again, so we're going to be looking at application question, because we have another clinical breakdown, and whenever you have a clinical breakdown, it's typically going to be an application, and we need to know social work terms to apply to this client's scenario to know what to do in this situation. So since it is an application, we are going to be able to apply the acronym. So keep that in mind. So recognize the client's feelings of hopelessness and her willingness to engage in therapy. B, develop a safety plan with the client in case her substance use and self-harm escalate. C, refer the client to a grief and loss group to help her cope with the death of her mother. D, provide information how the client can better control her anger. So recognize the client's feelings of hopelessness is going to be a feelings option, because you'd be validating and recognizing the person's feelings, as well as establishing rapport with the willingness, recognizing that she's willing to help address these issues. Develop a safety plan with the client. So in this case, since there is actual intent, you would develop and be a safeties option here. However, if the substance use and self-harm weren't a huge factor, it might be an intervention, so be wary when you see that option. Refer would be refer, and then provide information how the client can better control her anger. So providing something would be normally an intervention. However, what you're providing here is information. So we're looking at our good old friend educate. So due to that, we follow the acronym order. Educate would definitely be out, as well as providing information would not be the first thing that we would need to do, because she's coming in for some type of resolve, and providing her information isn't really going to have her feel recognized or even get some type of information. Referring her to a grief and loss group would only be addressing the death of the mother, and not really anything pertaining to her anger as well as her self-harm and substance use. So you have to remember to prioritize the type of issues we're looking at here. So in this situation, being able to definitely prioritize the substance use and self-harm over the anger, as well as feelings of hopelessness due to her saying, I don't know what to do anymore. So when we pull these out, feelings would not be the next option, because safety is above it and is actually a true concern and risk to her safety. So that is why that would be the correct answer here. And the two driving things were that she stated that she doesn't know what to do anymore, which could be taken as potentially suicidal ideations, as well as there is self-harm and substance use. So substance use, she could use too much substance and an overdose, or self-harm, harm herself to the point of not being able to come back from that. So that's how you'd view that type of question. And again, I do offer private tutoring where I sit down, break down specific practice questions if that is what your interest is, as well as specific content areas, because I've done that as well, of where you and I go over a specific topic. I break it down to the point where you actually understand it. And I do answer my email pretty frequent, but if it does take me a little bit of time to get back to you guys, just know that I'm not ignoring you. I'm just kind of busy. And comment any feedback on the video, that things that you found helpful, questions that were kind of tricky, how you did on the questions. That'd be something I'm a little interested to hear from you guys. Did you get them all right? Did you not get them right? Were there some that you got wrong? And if so, why? What did you miss, or what did you add in on your own perspective? Like the video, just helps bring more social workers that are in need to the videos when there's likes on the video. And it's amazing how much you guys are supporting it, but just tapping that little thumbs up button helps bring a lot more traffic to it, as well as subscribe for more videos. If you subscribe to the video, you get email notifications every time I upload, as well as when I stream, if you guys want to engage with me during the chat. And as though some people noticed today that I did respond to your guys' chat. And next week's study group, for those that don't know, I host study groups every Sunday at 7 p.m. Eastern. I've done a couple of them. Like today's topic was ethics, and next week I do it based on what people request during that group, and they wanted Freudian theory, and so I will be going over psychoanalytic, as well as going into the defense mechanisms and breaking them down to them and giving examples beyond the basic ones that you guys would normally get. They'll be tailored specifically to what you guys would actually need and be able to apply to on the exam. So the way that you sign up for that study group is just emailing me and saying that, hey, I'm interested. I'll forward you the information. It's a small fee. And yeah, I just want to thank you guys for watching my videos, giving me the support, passing the exam. There are so many awesome social workers that are using my style and breakdowns and getting positive results. So I hope you guys do as well. Thank you guys again for the support, and I'll see you guys in the next one. Take care, guys, and as always, do the best that you can with what you have, because that'll take you further in life than anything. Peace out, guys.